refrigerated stability, an increase from 31 days out to 10 weeks, as well as it enabled us to dilute the product from 0.5 milligrams per mil to 0.1 milligrams per mil, making it easier to prepare the dose. Chris is a precedented buffer in biotechnology and has been used in at least 3 vaccines. Our decision was based on empirical stability data, manufacturability, and ease of use for pharmacists and healthcare professionals. We prefer not to speculate about the underlying chemistry. We have performed an extensive comparability evaluation comparing the 2 formulations and have found them to be biochemically and pharmaceutically comparable. Please note that the manufacturing process of the RNA active ingredient and the lipid nanoparticle is completely unchanged. The only change is in the formulation, which is the last step of the product manufacture. Again, there is no change to the active ingredient.
Thank you.
That's about it. If we watched for the next 7 minutes, there would be another pretty good quote, but it's not worth it. I don't have it like ironed out exactly, but it's not good. I mean, he literally, they just said that we didn't do the clinical trials and we came together on a bioequivalence agreement with the FDA, and we prefer not to speculate on the underlying chemistry. What do you mean we shouldn't speculate on the underlying chemistry? You're changing the last step of the formulation. Like that's if they didn't have emergency use authorization, which is a scam in its own right, that's fraud. You know, that they're pulling all these strings here, and it's a red flag. I mean, even the left, you know, I don't want to say, you know, anything wrong. The people on the left that were willing to go get this shot, right? Do you think they would have actually took it if they knew that it wasn't even clinically tested? I don't think so.
We know that it was implied by Kamala Harris to the Black community not to take the shot because Donald Trump was pushing it. Because, you know, it could be a Tuskegee experiment part 2. It was one of the craziest shifts in narrative I'd ever seen. So, you know, that's 6 weeks before the election. They get put into the office, and it's the exact opposite narrative now. That it just blew my mind. But that, you know, that's what we saw was this immense pressure to persuade people one way or the other. And as soon as the elections were over, it was, I mean, the deals were made with the pharmaceutical companies between them and the politicians and insurance companies, and it was full bore vaccine no matter what cost. And any drug that could be argued as a therapeutic was maligned by the medical community that had encouraged it years prior. We talked about this last week. It was the craziest reversal of, you know, like herd immunity. They changed the meaning of that. Like it's, you know,
they're changing a lot of things nowadays.
Yeah.
They changed, like within the last 4 years, they've changed everything. You know, I mean, for baseball, even they're letting the Yankees grow facial hair nowadays. You know, they're literally just changing the NFL. They changed the way that the kickoffs work. Like they're changing everything. So, you know, so we don't recognize anything subconsciously. But obviously back to all of this, you're spot on. I mean, they're changing the definition of immunity. They're changing the definition of even what a vaccine was, right? And I mean, for me, it's all, you know, it's obviously all vaccines are poison, but regardless, if they were able to use ivermectin or hydroxychloroquine or chloroquine as a stopgap for the emergency use authorization to not go through, that would have been great.